Hello, Ali. Thank you very, very much for being here. So first of all, please, when were you first diagnosed and what with?
Okay, I became ill in my early 20s while I was at university. I developed a lot of pain, tiredness, migraines, and I remember the terrible neck problem. And then in my early 30s, I was told I had fibro, ME, and then I developed very nasty inflammatory arthritis, so I was told gout. And I'd also, in my early 20s, had developed thyroid problems. And then I just started becoming sicker and sicker, where I was actually had to go to Bath Mineral Hospital 36 times in 1 year, and I was actually under other hospitals as well. They even had to go and put a special loo in the house because my joints had had it. And then it was in 2015, at the end of November, that I sent my bloods to Germany, to AONM, and they came back positive for Lyme disease and various co-infections. So my GP, in response, said, well, you'll have to go and see an infectious disease specialist. Oxford is a choice, or Banbury, but Banbury and Oxford are run the same hospital. So I went to Banbury because that was the quickest. And they put me on antibiotics, but they also took my bloods for a UK test. But obviously I was quite worried about that because I'd got quite a history of steroids as well. And I'd actually had a bite back in the late 90s. And then I went back to my appointment and he said, we can offer you cognitive behaviour therapy. So I said to the doctor, well, obviously, if you don't think I've got Lyme. And he said, well, Alice, I wouldn't have put you on antibiotics, if I didn't think that. So we had a bit of an argument, and he then agreed that he would do another month of a doxycycline. So I went on that, and then we went back to my final appointment, and he said that was nothing else he could do. And then I received a letter stating that I actually hadn't got Lyme disease. And obviously I was pretty cross about this. So we put a complaint in, and I got a letter back from the chief exec of Oxford stating that I got active Lyme disease. And then it was one night I was being admitted to hospital with a knee problem, and the GP had been out to assess me, and she left my notes on the sofa, and something made me open them, and there'd been a phone call from Oxford saying that patient doesn't have Lyme disease. It's not right. So, of course, then we went into a very, very long argument and a lot of complaints. I managed to actually, the final complaint, they had to withhold half of it up. So then then I deteriorated further health-wise, and orthopedics were very worried, and my rheumatologist was worried. So they said, you need to see another infectious disease specialist. You can go anywhere in the country. And I said, but I don't know any decent ones. So in then they sent me to Bristol, where now they've kind of accepted, they have put in writing, yes, she's definitely had Lyme disease. So, but then I'm told, there's no cure. So, there's still kind of slight mixed opinions, but it's now in my notes. And actually, when I was recently admitted to Gloucester Royal with septic arthritis, it says on my notes Lyme disease.
Okay, thank you. And what do you feel about the original fibromyalgia diagnosis?
No, it's not fibro. I think the problem with Lyme, it causes so many symptoms. So to put all these different titles like ME, fibro, no, I think it's Lyme disease creating the whole problem.
Okay, thank you. And what was it that first inspired you to do campaigning?
It was in my early 30s after I'd gone to seek private care. I couldn't understand why the NHS weren't doing more for patients. And I was seeing a doctor in London taking some treatments that was working for me. So I challenged the NHS. And from that, I then set up 3 groups with Stroud, Cheltenham and Morton-in-Marsh. And also then another group, Minchinhampton. And it was just the day I went to see a teenager who was being tube fed in a dark room, and I saw her face, and it just horrified me what was going on. And I felt the silent voices weren't getting representation. So then I started to apply for funding, like with the lottery, to do things like medical packs, start campaigning more nationally and locally to try and make change.
Oh, great, thank you. And have you managed to involve your MP or any other parliamentarians?
Yes, my MP, Alex Chalk, is very involved with all the illnesses. He's great, you know, he can see the problems we've got, and he's been involved with APPG for Lyme disease.
That's
And also,
fantastic.
oh yes, one other thing, he's helped locally with getting patients together. We've had meetings with patients locally to see, you know, what experience they've got.
Oh, great, thank you. And then, is there anything that we here can do to help you, those who are actually here? Is there anything directly useful that we can?
Well, my latest idea has been, Alex asked me the other day, he said, what can I do, Alice, to help? And I said, well, really, you need evidence, and without evidence, you can't move forward. And it's, you know, I've done projects in the past where I've worked with Healthwatch and Link, and I've provided evidence, and we've managed to make some change. So the latest idea was that we get people to write about their experiences with infectious disease specialists. It seems to be quite an area that there's problems, and we need change in this. So I need patients to write up about what's happened to them. You know, good experiences will help, but obviously I haven't heard of any of those. And it's
Thank you. And is there a time frame for that? What sort of,
just
how quickly?
Probably over the next 6 months, we can try and compile stuff together.
Okay. And should people do that anonymously or give their details?
I think ideally a name does help because it makes them look like that, you know, proper person.
Right. And where should they send those, please?
If they can send it to, my email address is fibrobabes@gmail.com.
Great. Thank you very much.
Send it to the right people.
Well, you're here today, so anybody who'd like to speak to you, please do just ask for Ali Reeve at the reception table if you like, and we'll make sure they find you.
Right.
Thank you.
Thank you.
Bye.
Bye.